over-the-counter sweets.
And we're seeing more of this, not just, you know, vitamin D deficiency, but all sorts of, as we were saying, sort of age-old diseases that we thought had gone. What are you seeing in your hospital, and what are the causes, essentially, of this sort of thing?
So at the Evelina London, not far from here, we're seeing on a weekly basis children with vitamin D deficiency, children with tuberculosis. In the last year, I've diagnosed 20 children with TB. We're seeing children with whooping cough. Sadly, in 2012, there were 14 cases of deaths.
So just break it down for us then. I mean, deal with the vitamin D deficiency first. Why are we seeing more of this? And it's quite easy to change that, isn't it? If you're a parent, you can improve.
So vitamin D deficiency is a preventable disease. You eat vitamin D in your diet, and also the skin produces vitamin D. Your diet needs to contain oily fish and other food stuff that contains vitamin D, fortified cereals, eggs, some mushrooms, for example. So there's a number of different foodstuffs that contain vitamin D. In this country, we don't have standard fortified milk, but in some countries, milk is fortified with vitamin D, and in the infants, formula milk is fortified with vitamin D. Now, we see a lot of vitamin D deficient mothers who then pass it on to their children, and so newborns can be vitamin D deficient and go on to develop seizures from low calcium levels.
Let's talk to the girls. How are you both now? How are you, Roma?
I'm okay.
You good? You enjoying school?
Yeah.
And playing with Millie? And being good sisters?
No.
Not playing with
Really
not
play
playing.
with
Why
her
not?
that much because we go to different schools.
Ah, I see. But when you're at home, and they're now fit as a fiddle, Mum.
Yes, they are. You know, I do give them vitamin D. I supplement them, and we use it as an excuse, but we do go on a hot holiday.
Well, that's the thing we were wondering, actually, whether we're so aware of not letting our kids out in the sunshine without hats on, without sunscreen on.
Yeah, so that has compounded things. Living in this country, although this last
There's
5
hardly
days
any sunshine anyway,
has been great. Factor 50 sunblock, not ideal, so we should expose our skin to sunshine at least for a few minutes at midday before putting on sun protection, and factor 30 is adequate. Of course, don't risk sunburn, but and then summer holidays in the sun and winter holidays in the sun, and expose children to parks and outdoor life. Children are watching TV and playing on computers much more these days.
Thank you all very much for coming in. Glad to see you're both fit and well now as well. Thank you very much indeed.
Thank you.
Well, look, as if to illustrate the facts, Laura is on Britain's best beach this morning, hopefully soaking up a few of those